Lung cancer symptoms. Did you know that lung cancer is the most fatal cancer, causing more deaths than any other cancer? In this video, we'll be going over 12 signs you may have lung cancer, even if you've never smoked. Number 1. Shortness of breath. Shortness of breath, medically known as dyspnea, can occur as the tumor blocks or compresses airways in your lungs, making it difficult to breathe. At first, you might experience getting winded after walking or climbing stairs. However, as the disease progresses, you may experience difficulty breathing even while at rest, which can significantly impair your quality of life. This can occur if the tumor obstructs your airways, or if there is fluid buildup around your lungs, a condition known as pleural effusion, further limiting their ability to expand fully. In addition to feeling winded or fatigued, you may find yourself avoiding activities that used to be easy due to this breathlessness. If shortness of breath becomes persistent or worsens over time, it is essential to visit a healthcare provider to determine the underlying cause, especially if it occurs in conjunction with other symptoms like a chronic cough, wheezing, or chest pain. Number 2. Loss of appetite. A loss of appetite is a common symptom in people with lung cancer, particularly as the disease progresses. As the body fights the cancer, it produces chemicals that can suppress hunger. In addition, the presence of the tumor and its effects on the body can lead to discomfort, nausea, and a reduced desire to eat. Loss of appetite can result in unintended weight loss and malnutrition, further weakening your body's ability to fight the disease. If you are losing interest in food, eating less than usual, or noticing a significant decrease in your appetite, it's important to discuss it with your doctor. Malnutrition can make cancer treatments less effective, so addressing appetite loss is crucial for maintaining overall health during treatment. Number 3. Persistent cough. A persistent cough is often one of the first signs of lung cancer. Initially, it may seem like a lingering cold or a smoker's cough, but it gradually worsens over time. This cough may be dry or bring up mucus. The tumor growing within the lung tissue can irritate the airways, causing inflammation and triggering a cough that refuses to go away. Over time, the cough can become increasingly painful, or it may sound harsher, more frequent, or even wheezy. If you notice that a cough you've had for weeks becomes more severe or changes in nature, such as starting to produce bloody mucus, it could be a red flag for lung cancer. Even if you've never smoked, a persistent cough should not be ignored. It is also important to note that a cough accompanied by pain while breathing or when laughing might suggest that the cancer has spread or is irritating surrounding tissue. Number 4. Fatigue. Fatigue is one of the most common and debilitating symptoms for individuals diagnosed with lung cancer. The fatigue associated with lung cancer is not like the tiredness you might feel after a busy day. It's a profound, unrelenting exhaustion that doesn't improve with rest. This is due to several factors: the body's response to the cancer itself, reduced oxygen levels from compromised lung function, and the physical toll that cancer treatment can take. As the body fights the cancer, energy reserves are depleted, leaving you with less energy to perform basic tasks. This symptom can significantly reduce your quality of life and make everyday activities, such as working, caring for your home, or even getting out of bed, feel overwhelming. If fatigue becomes severe or unmanageable, it is crucial to talk to your doctor, as it can also be a sign of advanced stage cancer or the body's response to the cancer treatments, such as chemotherapy or radiation. Number 5. Frequent respiratory infections. People with lung cancer are more susceptible to respiratory infections, such as bronchitis, pneumonia, and upper respiratory tract infections. This happens because lung tumors can obstruct airways, making it harder for your lungs to clear mucus and debris. Additionally, the immune system is often compromised by cancer itself, or weakened further by cancer treatments like chemotherapy. If you find yourself getting sick more often, or having difficulty recovering from infections, it may be time to consider the possibility of lung cancer. Frequent or severe respiratory infections that don't respond well to antibiotics or other treatments can be a sign that the cancer is affecting the lung's ability to defend against pathogens. If you notice recurrent respiratory infections or unusual symptoms like coughing or chest pain, you should consult your doctor for further evaluation. Number 6. Unexplained weight loss. Unexplained weight loss is another warning sign often associated with lung cancer. If you are losing weight without making any changes to your diet or exercise routine, it could be a sign that something more serious is occurring. This weight loss is often gradual, but it can be more rapid as the disease progresses. Tumors consume energy from the body at a higher rate, leading to muscle and fat loss, a phenomenon known as cachexia, which is common in cancer patients. Moreover, lung cancer can interfere with your body's ability to absorb nutrients, leading to malnutrition and further weight loss. Along with a decrease in appetite, you may find it hard to maintain a healthy weight. If you notice unexpected weight loss alongside other symptoms like fatigue, coughing, or chest pain, it's important to seek medical advice to rule out lung cancer or other underlying conditions. Number 7. Chest pain. Chest pain is another significant symptom to watch for, although it doesn't always occur in the early stages. As lung cancer grows, it may begin pressing against the chest wall, ribs, or surrounding muscles, leading to pain. This pain can range from a dull, constant ache to a sharp, stabbing sensation. Often, the pain intensifies with deep breathing, coughing, or laughing, activities that put additional strain on the chest. In some cases, chest pain may be mistaken for musculoskeletal pain or heart problems. However, when it is persistent, unrelieved by over-the-counter pain relievers, and combined with other lung cancer symptoms like shortness of breath or unexplained weight loss, it's essential to seek medical help. If you experience chest pain with dizziness, confusion, or sweating, seek emergency medical attention, as these could be signs of a more serious problem, such as a heart attack or complications from lung cancer. Number 8. Hoarseness or voice changes. Changes in your voice, including hoarseness or a raspy sound, can occur if a tumor is pressing on the nerves that control the vocal cords. This can make speaking difficult or strained. Hoarseness that persists for several weeks without any clear cause, such as a cold or sore throat, warrants investigation. In some cases, hoarseness may be accompanied by a sore throat, difficulty swallowing, or a feeling of tightness in the throat. If you notice your voice changing, particularly if it's associated with other symptoms like coughing, chest pain, or difficulty breathing, it's essential to consult a healthcare provider to determine whether lung cancer is affecting the vocal cords or nearby nerves. Number 9. Hemoptysis. Coughing up blood, or hemoptysis, can be a terrifying symptom that signals the tumor has eroded blood vessels in your lungs or airways. This can range from small streaks of blood in your mucus to larger amounts of blood being coughed up. If this occurs, it should not be ignored, as it may indicate that the cancer is advanced or that the tumor is interfering with the normal function of blood vessels in the lungs. Although coughing up blood can sometimes be caused by conditions like chronic bronchitis, pneumonia, or infections, when it happens alongside other symptoms like persistent coughing, chest pain, and shortness of breath, it could be a sign of lung cancer. Immediate medical attention is necessary to assess the extent of the bleeding and determine whether the cancer has spread. Number 10. Wheezing. Wheezing is a whistling or squeaky sound that occurs when breathing, particularly during exhalation. It is often caused by narrowing or obstruction of your airways, which can happen when a lung tumor grows large enough to block airflow. Early on, the wheezing may come and go, but as the tumor enlarges or spreads, it can become more frequent and persistent. Although wheezing is commonly associated with asthma or allergies, when it occurs along with symptoms like chest pain, persistent cough, or shortness of breath, it may be a sign that something more serious is at play, such as lung cancer. If you experience new or worsening wheezing that doesn't respond to traditional treatments, it's important to get evaluated by a healthcare professional. Number 11. Swelling in the face or neck. Swelling in your face, neck, or upper chest can indicate a serious condition known as superior vena cava syndrome. This occurs when a tumor presses on the superior vena cava, the large vein that carries blood from the upper body to the heart. When the tumor blocks this vein, blood backs up in the head, neck, and upper chest, causing swelling. This swelling can be accompanied by a feeling of fullness or tightness in your neck, trouble swallowing, or even dizziness. SVCS can be caused by lung cancer, especially when the tumor grows large enough to affect blood flow. If you notice that your neck veins are visibly swollen, your face looks puffier than usual, or you're having difficulty swallowing, it's essential to seek medical attention immediately. SVCS requires prompt treatment to alleviate pressure on the vein and prevent further complications. Number 12. Constipation. While not a commonly discussed symptom of lung cancer, constipation can occur, particularly in the later stages of the disease. As lung cancer progresses and spreads, it may impact your digestive system. Tumors that spread to the abdomen or intestines, can cause blockages that lead to constipation. Additionally, cancer treatments, including chemotherapy and pain medications, can slow down the digestive process, leading to difficulties with bowel movements. If you are experiencing persistent constipation, accompanied by other symptoms like bloating, unexplained weight loss, or abdominal discomfort, it may be a good idea to consult your doctor to rule out lung cancer or its effects on the gastrointestinal system. Those were the 12 signs of lung cancer. Did you know that having liver cirrhosis increases your risk of developing lung cancer? Check out this video to learn about 12 signs you may have liver cirrhosis. Thanks for watching. See you in the next video.